Think Medicine presents Dementia. Early signs you shouldn't ignore.
Dementia, a disease affecting millions globally, is not just a simple case of forgetfulness or odd behavior. This condition can significantly impact individuals and their families, causing confusion and heartache. Early detection of dementia is crucial for effective treatment, but what are the symptoms we should be alert to? Before we delve into the signs, let's first understand what dementia is. Dementia is a broad term that encapsulates a group of symptoms. These symptoms are linked to a decline in memory, reasoning, or other thinking skills. This decline is severe enough to reduce a person's ability to perform everyday activities. It's not a specific disease but describes a wide range of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. Alzheimer's disease accounts for 60 to 80% of cases. Vascular dementia, which occurs after a stroke, is the second most common dementia type. But there are many other conditions that can cause symptoms of dementia, including some that are reversible, such as thyroid problems and vitamin deficiencies. Now that we know what dementia is, identifying its early signs becomes critical. Let's look at common early warning signs. Memory loss, the first and most common sign of dementia. Now, we're not talking about the occasional forgetfulness we all experience. It's normal to misplace your keys or forget an appointment once in a while. But with dementia, this forgetfulness becomes more frequent and starts to interfere with daily life. It's the kind of memory loss where someone might struggle to recall recent events, repeat themselves, or forget why they entered a room. They may also start to rely more on memory aids or family members for things they used to handle on their own. The confusion that comes with this kind of memory loss can be unexplained and often unexpected. It's as if the familiar becomes unfamiliar. So, if your loved one is frequently forgetting things, it could be an early warning sign. Next, difficulty with familiar tasks. Another clear sign to watch out for. It's not just forgetting where they left the car keys, it's puzzling over how to use them. People with dementia often find it hard to complete everyday tasks that were previously second nature. This could be anything from forgetting how to tie their shoelaces to struggling with cooking a meal they've made 100 times before. It's important to remember, we all have off days where we might struggle a bit more than usual, but with dementia, these difficulties become more frequent and start to interfere with daily life. The familiar becomes unfamiliar, the routine becomes complex. This is not about forgetting a step in a process, it's about forgetting the process itself. They might even forget the purpose of the task at hand. So if you notice your loved one struggling with familiar tasks, it could be a signal that something is not right. Third, problems with language. A common but often overlooked sign. Dementia can subtly interfere with one's ability to communicate. It might begin as a struggle to find the right word for an object or a concept. For instance, a person might forget the word telephone and instead refer to it as the thing we talk into. As dementia progresses, this can evolve into substituting completely unrelated or inappropriate words, leading to sentences that may not make sense. They may also repeat phrases or stories unaware they've just told them. It's important to note that these language difficulties are not due to a lack of vocabulary or poor education, but rather the result of changes in the brain caused by dementia. So remember, problems with language are not just about forgetting the right words. They're about the brain's diminishing ability to use language as a tool for expressing thoughts and understanding others. Changes in mood or behavior, a subtle but significant sign. When it comes to dementia, the signs aren't always as clear as forgetting where you left your keys. Sometimes, they're as subtle as a shift in personality or unexpected mood swings. Imagine a loved one who has always been the life of the party suddenly becoming withdrawn, or a normally calm individual becoming easily agitated. These could be more than just a passing phase. It might be a sign of dementia. It's important to remember that we all have off days, but persistent changes in mood or behavior, especially those that seem out of character, could be a cause for concern. If someone you care about is acting differently, don't dismiss it as just a bad day. It could be an early sign of something more serious. Mood swings and personality changes are more than just a bad day. Disorientation to time and place, a confusing sign for both the person experiencing it and their loved ones. This particular symptom is quite disconcerting. Imagine, if you will, living in a world where the concept of time is a puzzle. It's like being in a maze with no exit in sight. Those living with dementia often lose track of dates, seasons, and the passage of time. They may have difficulty understanding something if it isn't happening immediately. Perhaps they think they're in their childhood home when in reality they're in their current residence. It's not just forgetting what day of the week it is, but a broader sense of disconnection from reality. This disorientation can lead to a lot of anxiety and distress for them as well as their loved ones. Remember, disorientation to time and place is not just about getting lost, it's about losing touch with the here and now, a truly disorienting experience. So, we've discussed the early signs of dementia. Let's take a moment to recap what we've delved into. We've journeyed through 5 early signs of dementia, each one a piece of a puzzle that may hint at this challenging condition. Firstly, we talked about memory loss. It's not just about forgetting where the car keys are, it's about forgetting recent events, conversations, or appointments. It's about asking the same questions repeatedly, showing that new information isn't sticking. Secondly, there's difficulty with familiar tasks. We're not talking about learning new technology here. This is about struggling with tasks that were once second nature, like making a cup of coffee or tying shoelaces. It's about the everyday routines that suddenly become complex and confusing. The third sign we explored was problems with language. It goes beyond merely forgetting a word here and there. It's about struggling to find the right words or using inappropriate ones. It's about sentences that don't make sense and conversations that become increasingly difficult to follow. Next, we touched on changes in mood or behavior. This isn't about the occasional mood swing. It's about drastic and uncharacteristic changes in personality or behavior. Perhaps a loved one who was once outgoing and cheerful has become withdrawn and suspicious. Or someone who was always calm is now easily agitated. Lastly, we examined disorientation to time and place. This isn't about forgetting the day of the week after a long weekend. It's about getting lost in familiar places, or being confused about where they are or how they got there. It's about losing track of dates, seasons, and the passage of time. Each of these signs alone doesn't necessarily mean dementia is at play, but if you notice a combination of these symptoms, it might be time to seek professional advice. Understanding these signs is the first step in helping your loved ones navigate through this journey. Remember, knowledge is power, and in this case, it can be the key to providing the support and understanding your loved ones need. Remember, early detection can make a significant difference. It's crucial to keep an eye out for the signs we've discussed today. If you notice a loved one struggling with memory loss, having difficulty with familiar tasks, facing problems with language, showing changes in mood or behavior, or experiencing disorientation to time and place, it might be more than just the normal aging process. It's understandable to feel overwhelmed, worried, or even scared when you start to notice these changes, but it's important to remember that these symptoms don't mean the end of the world. They're the beginning of a journey, and like all journeys, it's best navigated with the help of others. If you suspect a loved one may be showing early signs of dementia, don't hesitate to seek professional help. Medical professionals, therapists, and support groups are all available to provide guidance, assistance, and understanding. They can provide a proper diagnosis, help manage symptoms, and offer strategies for coping. Remember, it's not just about the person with dementia. It's also about the caregivers, the family, the friends. Everyone who's part of this journey needs support, understanding, and care. Dementia is a collective experience, and it's something we face together as a community.